everyone. I am really happy to be here. You see from my name badge that I'm a first-time attender to CCHF. Heard about it numerous times from colleagues because I've been a part of the CCDA conferences and also the Accord Network, which is International Relief and Development Organizations, where there are so many organizations that overlap. And I think there's probably also a conference of Christian conference organizers that goes on somewhere. Dr. Kim and I met. Can I call you Esther?
Yeah, call me Esther, please.
We met about 3 years ago. And it was about that time that our organizations, although we had navigated and worked in the same space and knew of each other, it's about that time that we really met as well and started engaging together as organizations. Wanted to start with some slides that said why we know each other. This is a map of Georgia on the bottom, and then a pullout of DeKalb County, and Clarkston is a municipality within DeKalb County, but people, when they say Clarkston, also mean the areas around it, meaning parts of Scottsdale, Decatur, Tucker. People have said it's the Ellis Island of the South, or the most diverse square mile in America, or some other places that would contest that. But it's what sociologists call a hyper-diverse community, because most resettled refugees that have come to the U.S. and been assigned to be resettled in Georgia have made their start. They've gotten their first apartments and started learning about life in the USA by being based in the Clarkston area. If not in the city limits, then just outside the city limits. Many refugee serving organizations have chosen to locate there because the federal government started assigning refugees to be resettled there for numerous reasons, not because it's the healthiest place or has the best schools or has the best services, far from it. There are some unique challenges there, but it is an amazing place to be. It's also attracted a lot of attention because it's such a hyper-diverse place with lots of restaurants and cultural spontaneity, and it's attracted a fair share of people who have moved there because they want to experience that kind of out of the ordinary neighborhood for Atlanta. So housing prices have gone up a lot. It's gotten harder for refugees to find places to stay. But over half of the households in Clarkston speak a language other than English as their household language. And about half of the people in Clarkston have come from somewhere else. Anything you would want to say about
I would say
Clarkston?
that it's just kind of give you guys a picture of Clarkston. There's a church, a mosque, and a Buddhist temple right on the same street. There are over 100 people groups represented and over 70 languages spoken. So English is the common language, but it is not the only language spoken. It is very diverse, but as you can imagine, people who are coming from war-torn countries who have never formally received school education, we also have a poor literacy rate, employment, and just poverty level is significantly greater than the rest of DeKalb County.
Yeah, a lot of the social determinants of health are going to create real challenges for households as they locate in the Clarkston area to compound the issues that folks may have brought with them. But it is a vibrant place because refugees come and in some cases have experienced trauma. Everyone's experienced grief and loss from being dislocated, but they also come with great gifts and abilities and just need a way to plug in and begin to adapt those experiences to their new context. So Friends of Refugees helps to do that, and Ethne helps to do that in different sorts of sectors. But just to drill in a little bit, when you're far from your home and you describe yourself to folks that come from elsewhere, it's easy to say that you come from the same place, that we both work in Clarkston. But literally, when you drill into Clarkston, you can see the locations where Ethne Health Clinic is and Ethne Dental Clinic is, and where Friends of Refugees has our sites of ministry. And we're constantly in each other's business.
Do their Embrace, which is their prenatal support group house. It's like 600 steps. You can literally walk there and get support. And I would say when we first relocate to Clarkston, we actually met with Friends of Refugees. They've been there almost 30 years now. They've had a history of being there. Rusty will probably share more of their history, but they've just been a faithful friend to the refugee community in Clarkston. And so as people who are new to the community, we look to them for guidance and for trust, for resources, and even just cultural navigation in this community when we started 6 years ago.
I'm led into this slide so well, Esther, and I added it since the last time we talked. But we can really think about Friends of Refugees and Ethne as having almost independent histories up until a few years ago. Friends of Refugees was founded in 1995 by a woman named Pat Maddox, who saw her neighborhood changing when she retired and came back to her hometown. And she felt like there was a growing disconnect between the newcomers that were being resettled as refugees and the old Clarkstone, and she wanted to bridge that gap. So she began to reach out and form relationships and really just friendships. So it's easy to name the organization because it just says what it was. It was Friends of Refugees. Grew as people heard about what was going on, and churches outside of Clarkston began to contribute and to bring resources to the neighborhood. 10 years later, they incorporated. And so we've been around for 30 years, depending on who you ask, but we've been incorporated for 20 years. Grew very organically, serving needs that seemed to be left over after people had been officially resettled by the private-public partnership of resettlement agencies, the 10 organizations that work around the country and provide for some very, very basic needs for the first 3 months to a year, and then a few extended cases beyond that. Obviously, you're not self-sufficient after 3 months of orientation and rent support and language exposure when you get to the U.S. So we call ourselves a post-resettlement refugee serving organizations. But if someone arrives to the U.S. from a refugee camp or from a war zone and they're pregnant, all of the resettlement agencies send them straight to Embrace so that we can begin walking with people and helping them get used to the very unique birth culture that we have in the U.S. relative to their own birth cultures.
Yeah, and Ethne Health, many of you guys have heard our story, but we actually birthed out of the CCHF network, where a group of us actually met in Memphis, Tennessee, where we were getting trained there as resident physicians. And we're praying to see where God has for us. And through the prayers and support of many in this room, actually, we identify a city of need. We heard about Clarkston, Georgia, a city that was called Ellis Island of the South. We did a few visions trip there, and finally in faith moved there in 2017. Really did a lot of home visits, really trying to visit different organizations like Friends of Refugees, partnering with Embrace, taking some of their calls and visit some of the families together. And then in faith open in 2018 as a medical home for Clarkston. And God graciously blessed us with different giftings. And just a year and a half ago, we opened our first dental clinic as well.
Esther and I were puzzling together about why we were operating in the same space for a number of years, but hadn't really cooperated formally in various ways. And there's a whole string of natural obstacles to that. But we have a lot of overlap. Here's just some of the things that came to mind very quickly, ways in which we overlap. We have this physical proximity in a hyper-diverse community. We both have an organization. We're Christian organizations, but working to a high professional standard, not just creating for Friends of Refugees friendships anymore, but looking for people who are actually trained in the sectors in which we are trying to provide assistance. We are both bridge organizations that have some sponsorship and relationships and networking in the secular space, but lots of rich relationships with the faith community, and are very much in the public eye and feel sometimes the glare from both sides about trying to navigate in that in-between space. We share a patient-client base.
Yeah, and so Friends of Refugees, they have different programs. So literacy is one of their strongest programs, where they teach women and children how to read and write in English. And a lot of our patients are benefiting from those programs. They also have growing leaders programs. And some of my teenagers that I see in the clinic are part of their program. And I remember this Afghan woman, she's like, "Doctor, could I introduce myself to you?" I was like, "Sure." He stands up, he's like, "My name is blah, 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 and I'm from Afghanistan." And she was beaming with pride. And I was like, "Where'd you learn that?" She's like, "Mommy and Me, the school at Friends of Refugees." And so even just seeing my patients' social determinants of health being addressed by brothers and sisters in Christ in the same kind of proximity.
And we very much knew that folks from our programs were being served by Ethne Health Clinic. And so we wished them well. And we're appreciative that they were operating in the same sort of space, but rarely did our senior leaders darken each other's doors to talk to each other about how our programs were organized and what we were doing. We share a donor base, churches and individuals and foundations that support both of us. And so when Friends of Refugees started working with a private consultant, interesting story was that one of our major donors came to visit our programs and came to Mommy and me. I'm pointing at Kate Lindsay because she's here from Friends of Refugees, along with her husband, who knows a little bit about Ethne. They came and they saw what we were actually doing, and they compared it with what it said on our website that we were doing. And he said, "You guys have crappy branding. Like, nobody could tell what they need to know about Friends of Refugees or about Mommy and Me by reading what it says in your literature about it. So let us help you by creating a better branding for you." And they hired a hotshot marketing firm from downtown Atlanta in a high rise, and they worked over our literature, interviewed people, and helped us create what it was. But one of the things they did was they analyzed our competition. They said, you need to look and see what the competition are doing, because some of them are really good at what they're doing in terms of branding and telling their story. And then they showed Ethne's website, and we just stopped the conversation at that point. And I think at that point, I was leading rather than reflecting what our organization's culture was, saying, these are not our competitors. If any of the fundraisers in this room found a donor who was willing and interested in giving to a health clinic, we should not try to direct them to give to Friends of Refugees and talk them out of what God has put on their heart. We should point them straight over to Ethne, and anybody who is evaluating you should count that as a win. That should definitely be a success for our fundraiser if they ended up inadvertently raising money for Ethne. But it shouldn't be inadvertent. It should be part of being a kingdom together. Anyway, the fact that we share this donor base is a great resource for us. And we'll talk a little bit later about telling a bigger story than just the one of our individual organizations. We also share a volunteer base that some folks volunteer at Ethne and volunteer at Friends of Refugees. We don't make that easy for people. Both require background checks and letters of reference and onboarding and orientation. And we're working now to figure out ways, and we have our first guinea pig going through a joint volunteer training program so that someone who's qualified to serve at Friends of Refugees could also immediately go over and meet a need at Ethne if those volunteer opportunities came up.
I think that came from the leadership to recognize that we want the flourishing of the community, right? If both organizations are doing what they're doing and people want to join, it's because they care about this community. And so why limit them and kind of stock them away and said, oh, only if we have an event, you can volunteer with us. We don't have an event this month, but you do. Let's let them be involved and continue to be a part of this community. But that took a long time for us to recognize this is the feel we're both in.
Yeah, because an organization's donor base often comes out of their volunteer base and vice versa. So it's very natural and very human to want to try to protect that base because there's limited resources in the world, and you should be able to get what you need for your organization to run and then maybe share if there's some leftover excess resources. And of course, that's not the way God's kingdom works. And we don't want volunteers to say, well, I am of Ethne, and someone else to say, I am of Friends of Refugees. But we water, they plant seeds. God is the one who's making the community flourish. So we should reflect that in the way we treat volunteers and donors. We both have staff which are highly skilled and actually have training and experience in what they do. They're not just showing up and we don't just hire our best volunteers to be staff people. Both are professional organizations, and the staff is very diverse. They reflect both the diversity of the community, but probably more global diversity than there is in the Clarkston community. Yeah, we just run into each other all the time with the same friendships, networks, desire to see the Big C church in Atlanta really live into their calling to welcome the stranger, to find out what it is to really see Jesus in communities of refugees and provide opportunities to do that. That isn't just about cultivating donors and volunteers and recruiting staff. It's about building the kingdom.
Yeah, and I would argue that there are over 30 nonprofits in Clarkston area, and they're all in the same proximity. And some of them have areas of overlap that are listed here, but it really does take more than that overlap to become partners. Would you agree?
I would. There's a couple of organizations of Christian ministries that try to keep up with each other and to get together and talk about what's going on in the community. And it takes resources, though, to actually lean into that sort of relationship building, to really know a network and to be curious. It's not just that you get over your fear of exposing your vulnerability to peer organizations, which is definitely there. It's part of the funny story when I went over to meet um, Esther and Ravi to begin with. That may come up, but it is more like, do you have the time? Do you see it as such a priority? Do you have the need to collaborate? Or is it just nice to get together in a space and I don't want to say this in a demeaning way at all, but just like, worship God together and pray together because you both happen to be Christians in Christian organizations in the same proximity. We do sense that God is calling our organizations to work together more deeply because of our DNA of why we're working and how we're working. That makes us more alike than with some other ministries working in the Clarkston area.
So just to kind of kick off our time together, we wanted to share a few stories before we get into the nitty gritty of who is your partner? How do you begin partnering? So in 2022, got a text from a friend that says, hey, there's this guy named Rusty and he's joining Friends of Refugees. He wants to learn more about ethne. Can he come and just join your devotional time in the morning? We're like, yeah, we know Friends of Refugees. We've been in partnership with them for many years. But at that time, we are just kind neighbors. If they needed something, we will help. If they needed something, they will help. And so Rusty came on a Friday morning with Kendra, their current CEO, and just spent time with us, getting to know us. And then Rusty became a friend who brought one of his friends to ethne, and he started seeing the inner workings of ethne and started seeing how doctors are being treated, how patients are being treated, and kind of what ethne is about. And then Rusty started inviting me to kind of their donor or their board member prayer time on Friday morning and recognized me as a partner to be in this space, to pray together and share. So I think it took a lot of invites like that for us to begin seeing ourselves as partners, as more than brothers and sisters, and someone that we're working in each other's community, but also our organizations. So many months they were praying for us to hire a provider. And during those monthly prayer meetings, they would list ethne as a partner and praying for us and praying for our funding. And last March, we received this incredible $2 million grant out of nowhere. And Friends of Refugee, all their staff came over with sparkling lemonade and flowers and a big card and says, congratulations, you guys got this grant. They didn't get a penny of it. But they were so excited for us because they've been praying for us for this grant. And that was the moment when I'm like, wow, I think they are more than just people that are working with us. They are truly cheering for us. They're rooting for us. And any wins that ethne is experiencing is a win for them as well.
We were only praying for $1 million for ethne. We had no idea that McKinsey Scott was going to be twice as generous that year. And one of our board members did ask, could we pray for our own fundraising now on a few of our calls? God has really answered our prayer there. The next month, a donor gave us a 3-year grant for $1.5 million. I think, in this redemptive way in which God works, things do come around. But we would have been just as happy if that hadn't happened.
Yeah, and I think, looking back, just the invitation of the leadership from Friends of Refugees, initiating some of these conversations, initiating praying for us and asking us how are ways to support your ministry. And I think that really took us from just kind of paralleling to intersecting kind of the ways that we're doing things at Clarkston.
I'll tell you one story, though, about why it took so long to get in the same room together and to have our leadership talking to each other and to be inviting each other into these vulnerable spaces of prayer was that we were an organic organization that grew up, and anybody who had a good idea could start a program within Friends of Refugees. And we were at times very much a siloed organization where the right hand didn't know what the left hand was doing. And it felt, although it was well governed financially, it wasn't unified in vision. And we were very acutely aware that we had these very well-known lack of unified vision for a number of years in the Clarkston community. And ethne had started 2.5, 3 years before we first got together to speak, but they had spent years refining their vision, traveling the country to think about where it was that they could enact this vision that God had put on their hearts, and got there and started down a path that they had called ahead of time. They knew what they were doing, and then they did it. And they seemed so professional compared to good old friends of refugees who had so many people with so many different ideas about what we should be doing in the community. And it was a little intimidating to think about going and sitting in a room with Esther Kim and Robbie Contino. And we didn't know what kind of reception we would have. And honestly, we worried a little bit that they would say, finally, you're getting your act together. It's been long enough. There was no sense of judgment whatsoever. No sense that, oh, well, we did it the right way and hope you guys can get on board and have a unified vision as well. It was more like an immediate sense of having a friendship and sharing and talking to people that you should have been in conversation with a long time ago and are so happy that you finally are. So it's hard to explain how an organization can have anxiety, but I think Friends of Refugees definitely had a kind of anxiety in the community because of some of our ups and downs in the preceding 30 years. If you want to hear more about that, come to my talk tomorrow. It'll really be a confessional booth, and you can hear some of the failures of Friends of Refugees and how we're praying that God continues to redeem the investment that he's made over 30 years and the flourishing community.
And one more story to share about just the work that God has allowed us to do together. So last summer, unfortunately, we had an incident where a little boy in our community had drowned in a local pool. And it turns out that it was someone that we knew. And so that afternoon, I was able to go with one of our neighbors just to be with the family. And little did I know, a few hours later, Rusty was in that same living room bringing food to them. And so Rusty had texted me and said, hey, I heard you were here an hour ago. And I was like, how do you know them? And this is a family coming from an area that it's highly persecuted, and they've fled war, and they've just been in the U.S. for a little over a year. And now they've lost their son. And so it was just a time of grief and traumatic for this family and their community. But at the same time, we were able to enter into the space together, not knowing. I didn't know Rusty knew them, and Rusty just heard I was there an hour ago. But just the Lord was working in our hearts, and the path of where we are sowing, this is the same feel. And I think that day I realized, wow, like we're getting into the nooks and crannies of our community together. And I needed Rusty, their community, and their support, just like they need us to be able to do this together.
And without the thought that in working together and seeing each other's work, there is a way in which folks want to isolate their work. I think we had this temptation and just do what we do really well and be accountable to ourselves for what we were doing. But that's as if we own a refugee family and they're our project, and we are the ones who are responsible for their flourishing. And realizing that you're part of a community not only relieves some of that pressure, but it also increases your honesty and accountability and transparency about what it is that you think is going to be accomplished in a family's life, because somebody else is seeing what you do. That's so healthy. It's not just a risky and vulnerable place to be. It is being known in the way that God knows us. So in a way, walking alongside Ethne with their patients and our clients and students lets us see that what we do is being done in front of other Christian organizations that we share fellowship and common goals in the Spirit with. They want the best for us. So we need to let them know and show them in the way we serve people what we do well and what we don't do well. And it's okay to be puzzled and mystified by how a particular family might get over the obstacle that they're facing. But we realize that it's really God's job, along with those families who are image bearers themselves, to get over that obstacle. Two organizations can come alongside to help make that happen sometimes. So I just put some language out on the table here because this is going to turn into a bit of a group exercise, if you're willing, about some ways that we can work together, describing different levels and intensities of working together. So we might use the word coordination to be what we were doing before, where we knew about each other. And then as we first got to know each other, it was like showing up and knowing what was on the website, but seeing it in person and being able to describe it to others so that we knew what made us distinct. And we also knew when to make a referral because we knew it was safe to do that. So it was coordination. It was trying to avoid some overlap at times, avoid duplication. This was a common in the mission field when the Methodists would take one district and the Presbyterians would take another district, and they called it comity, not comedy, although I'm sure it was pretty funny sometimes to see people try to figure out what these two different denominations were doing. But it was, comity to like say, we're going to split the field here and not overlap and not get in each other's way. So coordination is sometimes about not bumping into each other and trampling on seeds that somebody else has planted. It is a little more intense. And I'd say this is kind of where we're hitting a sweet spot here, is beginning to share some systems like our shared volunteer training and be able to really understand what it happens if we make a referral and when that information is going to get shared back, sharing some training. Those are things where you're being changed by the partnership, by the relationship. Coordination is more like billiard balls running into each other on a table. Like, a billiard ball isn't changed, but they influence what's going on. And that's a terrible metaphor. It is this metaphor of impact, right? So we could do something that interferes with a shot that someone else is about to take if we don't know how our balls are arranged on the table. Integration is where there's change going on with the organization. And the last stage here is what we're just starting to try out now. Innovation, of trying to make things that didn't exist before in the world. And I think this is really this role as image bearers of being sub-creators, like being like God and imaging God, in that we're bringing new things out of the wealth of the earth and the relationships of the people that are here. But there's this foundation of relationship building that goes before and has to underlie all of these ways of working together. And that's costly. So we're not arguing that everybody should partner with and coordinate, integrate, and innovate with everybody else. But getting to know each other lets you know which of those models you might choose or whether to just kind of be aware of each other. Praying and worshiping together is a place of vulnerability. I remember the shock's the wrong word, but raised eyebrows when it was revealed that Esther was going to be on our monthly first Friday fasting and prayer day on our Zoom call in the morning. And we're not just praying for Ethne and we'll tell them later that we prayed for them. She was going to be live and helping to lead that morning. And that was a brand new thing. It's like somebody from outside is coming in to pray for us. But that's about the time that we were realizing that Ethne was not outside in that worldly sense. You guys have relationships. You're all part of organizations or clinics or churches, and you're trying to create some relationships with those outside. So I wonder if you could get in twos or threes and talk just a little bit about some of the partnerships that you have, some of the relationships that you have, and see if they represent any of these boxes on here, like where you are right now. What do you want to do? And you need to choose one of these models, or where are you and how is that going?
Are we going to come back together in a bigger group and want to hear some of the conversation that's in the room? Anybody want to share about a reflection or what your group shared in regards to kind of this model of partnership?
You guys are just getting going.
Yes. You want to come and use the mic?
Actually, what I was reflecting on, because I am part of one of the founders of Ethne and my wife works for Friends of Refugees. But the interesting thing about what you shared, Rusty, and what is that part of Ethne's incorporating the mission, vision, and values into our DNA, like that we have done from the very beginning, came from talking to the previous director of Friends of Refugees, who said there is a lack of unified vision and mission in our organization. Don't let that happen to you. And then that was reemphasized by a former board member and then former interim director of Friends of Refugees, who is now on our board, Kevin Kipfer, saying the same thing. Like, we have a secular vision, we have a Christian mission, and there needs to be alignment. And so even before this reunification within Friends of Refugees, like, we were receiving counsel from them. So it was just like a full circle, and it's pretty beautiful, I think.
Thanks for sharing that.
Anyone else? Actually, I was just asking Rusty, and I was like, is it linear? Like, do you coordinate with someone build the trust, to eventually integrate, to innovate. And honestly, as we were discussing, it feels like you can do all of this simultaneously. And there is not really a linear path, but the relationship building is really what's mattering at the end of the day.
Yeah, it's not like you set out and you study the context and you put all the inputs into a truth machine and turn the crank and it says, oh, well, you should be integrating. It is you as a priest king, you have the authority to decide which of these models to pursue, but you can use wisdom in choosing which way to go with it. And I think Athenian friends, for example, are still doing all three of these ways of working together. It's not like we're graduating to co-creation. And I guess if we were corporate raiders, we'd say there's another box on here, which is mergers and acquisitions, which sometimes also is a way that things can work and the kingdom can be advanced.
Yeah, and I think Rusty has gotten a few comments from donors because Rusty and his team of the development team, they have a spiel they tell people about ethne, and they consistently practice that spiel to make sure they are getting what ethne is about correctly. And people have asked Rusty, then why don't you guys just merge? Because you're so in line. And what do you tell them?
Well, it's pretty obvious with ethne that there's a set of specialties that make that an amazing place. It's not just the history of the friends who came together to have the idea and moved together. It said it takes a special kind of DNA to be a medical home for people, to be a family practice clinic that can actually be a navigator in the health system in ways that Friends of Refugees should never try to develop that expertise. And if we ever did merge, it would be like this almost completely independent company within Friends of Refugees. But we are thinking more and more about what are the ways in which people have needs outside of the medical world that we also encounter at Friends of Refugees and try to problem solve and help people troubleshoot. And maybe we can start sharing some of those functions while preserving the things that make us really, really unique.
Even just a few examples as we were talking about how we have seen our organization coordinate or integrate. During COVID-19, the pandemic, our clinic was providing testing, but we really needed someone to help us provide food for the patients we were testing because they were going to be quarantined and unable to work. And so we reached out to Friends of Refugees at the time and was just saying, hey, can you guys just take care of the food part for us? We'll swap them. We'll give them excuse for work with the Atlanta Food Bank, get these food ready. And they went out of their way and pack halal meat and getting the food that our refugee neighbors would eat during the quarantine and delivered it to their homes for us. And so that was kind of one of the first times we kind of went in together on a project. And then most recently, he was mentioning we started sharing systems, sharing ideas of how do we do volunteering better, training, how we follow up with some of these donors, especially churches. A lot of churches do give up to both our organization, and they have come back and asked us, is there something you guys can do together? And if you do, I'll give you more money, because they're giving us each a certain amount. And so we're really in the space right now trying to co-create something that these common donors can give to and give larger amount. And that is something that we're working on for this fall.
Do you want to say what it is?
Well, sure. So in the last few years, we've just seen a high infant mortality rate in our community, especially in our refugee moms. In the last few years, we've lost a few babies, and moms have had to stay in the ICU for various reasons. And all of that is because of lack of prenatal care, consistent prenatal care. And as Rusty mentioned earlier, Friends of Refugees has embraced prenatal refugee birth support group, where they provide teachings and courses and childbirth education courses and doula to support them in the hospital. But if you don't have a clinic or someone who is doing prenatal care with them, and you're just supporting them at the time of delivery, we're missing a lot. That has been brought up to us many times. And at ethne, we've really trying to figure out how we can support that, because we're seeing the families after, and we're seeing families struggling and poor health outcome. And so we co-wrote a grant recently and through Direct Relief, and we're able to launch what we call our Peace Clinic. It will start this fall, where we'll actually do some prenatal care at ethne for embrace moms that are going through the childbirth education classes, that will have a doula at delivery. And we're going to kind of be in the gaps of providing prenatal care for the moms that are going to be in this pilot project. And it's scary, right? Now we're putting them as a part of our budget, and they're putting us on their budget, and we co-wrote this grant, and we're going to more funders to say, is this something we can sustain more than this 2-year pilot project period time?
But it's scary because our success is completely wrapped up in Ethne's success now, not just in an abstract spiritual sense in which we care deeply about whether they rise or fall in any way, but the fortunes of our organizations are tied together in certain ways. And that's not the kind of partnership you want to have with just anyone. There's a great deal of tuning up that is necessary for that. Yeah, I will say and ratify what Esther said is that when we go to churches to describe the work that their investment in Friends of Refugees is accomplishing in Clarkston, we're less and less telling that story in terms of Friends of Refugees being this awesome agent of change in the community and a great place to park your investment dollars and your gifts. It is really that we are part of a constellation of players, and one of the key ones is Ethne Health Clinic. And we'll often find that the church is already supporting Ethne. And so then the story to tell is that you have a ministry and a footprint in Clarkston that is for refugees, that is for the people of Clarkston. And we're players in that space too, along with Ethne and MDM and Refuge Coffee and Friends of Refugees. It's that we are in this work together as partners, rather than I'm always trying to get your donor dollars to be directed toward my own organization. And people are much more spiritually enlivened by the sense that God is doing something bigger than any one organization in this space. There's another way of looking at ways that we work together that has been really useful for me. And I just Esther said it was okay to show a couple of slides. This is from a book called The Redemptive Nonprofit by an organization called Praxis. There's 3 books in a series. One is called The Redemptive Nonprofit. One is called The Redemptive Business. And another is called The Redemptive Investor, saying, well, you'll see why they use the word redemptive here as we describe this, but the people, individuals, communities, and organizations approach the world with one of 3 different mindsets. You can either be exploitative, ethical, or redemptive. I think this will make intuitive sense to anybody who's here at this conference. The exploitative way is the way of the Wall Street raiders, take all you can get. Try to gain any advantage, to prevail, to possess. Exploitative actors most often approach the business with a zero-sum, I win, you lose, scarcity mentality. Motivating force is to win and control. We see it all around us, and we all have had relationships with organizations or with individuals who we think were in it for themselves. We did not leave feeling like anything new was created in the world or that we were fairly treated. We felt like we had to grope and scrape to get what was due to us because that's what our partner was doing. And it was hard to make an advance in that way. It's very extractive. Nonprofits can treat their staff in these extractive ways by trying to get them to work as much as possible, keep pay as low as possible, not look at increasing benefits or adding healthcare or do any of the things that would make flourishing life possible for their staff. And then if people start demanding too much, you would let them go and find somebody else who'll do the work and be glad to do it. The ethical way is the way the world tells us is the right way. I think this is from long-term Christian witness in the world, but you should do no harm. You guys know that phrase. Keep the rules, play fair, solve problems, add value, look for win-win solutions. Motivating force is to be good. This is a fine way to operate in the world. This is the sine qua non. This is the standard to which everybody should be satisfied if they reach it and try to do better if they don't. But it leaves a lot of things on the table in terms of our roles as priests and kings in the world, creating things that are new. So there's this final way that they describe, which is the redemptive way. And it's characterized by this phrase, creative restoration through sacrifice. It's not take all that you can get. It's the idea that if I sacrifice, we win. I can put myself at risk. I can put resources at risk, use my agency on behalf of everyone. And it's the way to love and to serve. We don't see this very often in the nonprofit space, but I think it's overrepresented probably in the CCHF community. Folks that would take chances and be creative and try things that haven't been tried before because they've gotten to know the hearts of others and they know that it's worth cooperating like that. And it's even worth cooperating like that sometimes when you're putting something good out into the world, when you say, we're going to put all of our ways of working and our operations manual and our employee manual and our community organizing methods online, and anybody can download them. We're not trying to keep a secret here. We want everybody to work the way that we do, and we'll go the extra mile to actually categorize and communicate those things well and make them available for others. So it doesn't have to be that you're going into a partnership with someone. It could be that you just invite people to come and see what you do. But it's more exciting if there are communities that are taking this dive together. So as you think through that list of ways of cooperating and the relationships that you described in your small groups, are there any of them that maybe fit now or in past experience in one of those three categories of exploitative or ethical or redemptive? And I realize there's a new typology for some folks. Yes. Can you speak pretty loud? Because we are recording it, but that's a really good point. And I know some redemptive organizations that are accomplishing great cultural good in the world, but they don't treat their employees well. Yeah. Thanks for that reminder. Anything else leap to mind where you may be in partnerships where somebody has taken a real risk and you've seen some huge change in the world as a result of it? I started an organization very much like World Relief here in the U.S. that was an international organization called Tear Fund. My first week on the job, Compassion rep called me and said, I've been working on this church in Kansas City that I think would really like Tear Fund. I was describing the way that you work to them, and I think that they would be better served by Tear Fund in your church mobilization work around the world to see churches involved in reducing poverty than by being a child sponsorship generating church. He said, here's the number. I told them you'd be calling. That was like my first week on the job. The second week on the job, the Chalmers Center set up a string of appointments with their main donors so that we could get to know them as well. So it's the same thing. It's like sharing those resources and being generous with them instead of tight-fisted and having closed hands towards each other is an amazing initial way of being redemptive. It's not all about new ideas.
I was just going to say, I see this in CCHF clinics and just the CCHF community a lot. Just being in this room, being in the U.S. healthcare system, it can be very that word. But at the same time, there is a different way. And I think CCHF tries to live out the redemptive way. I just was emailing someone from Jericho Road a few weeks ago. It's like, we need help with HR. What are some of your resources? And I think Lawndale has their policy and procedures on their website for people to use. And I think people need to see more of that because it feels like a lot of times we are not working together, but there's so much more that we can accomplish when we do it together.
And I love that thought that an organization might have different personalities with different audiences. Thinking through these approaches and applying them rigorously to the way your leadership works, the way your governance works, the way your operations work, and the way your public posture and communication works can help to more thoroughly transform us and to renew our minds so that we become those living sacrifices that are what God's intention is for us to be.
Well, we have a few minutes left. We have a few recommended resources, but we want to just open up for some questions. One thing I'll point out, the book in the middle. So Friends of Refugees actually just went through a book study with all their staff, with the senior leadership on spirituality of fundraising. And my friend Virginia is a part of the group, and she's like, hey, you should be reading this book too. And so me and Kirk, our development director at the time, read the book together and discussed some of the ideas with our friends. And so that was just sharing of resources and having the same common language of fundraising and kind of resources has been really helpful.
It was 3 years ago that I met Steve Novelet and talked to him about some of what I'll share and invite people to comment on tomorrow about our own journey in spiritual identity. And he described some of the generational change going on around clinics that have started with a Christian posture, and then are professionalizing and wrestling with what that looks like in their new space. And one of the first places he said that I should go to look is your own organization. So looking forward to talking afterwards. But he was really the first big voice that recognized that what we were facing at Friends was not unique and not anything uniquely shameful either. That we could be encouraged and keep moving and making progress. That's a beautiful example. We'll use that as our closing example. Very generous, open-handed posture. So thank you very much.